Now I'm going to take you through the section on treatment support systems. So treatment support for TB is a comprehensive set of activities which are essential to help the patient continue on treatment and adhere to the treatment. At the same time, get the necessary care and attention while on treatment if they come across any issues, may it be due to adverse drug reactions, or may it be due to nutrition, or may it be due to allowances for transportation cost, or meeting the cost for various other aspects, adherence monitoring, counseling, etc. So right from the beginning of the treatment, if you look at the flow of the patient and the journey of the patient all the way till the end of treatment, the most important step is when the patient is prescribed the necessary treatment, where counseling comes into picture, and the decision of what would be the suitable method of treatment support, of adherence monitoring, that has to be discussed in consultation with the patient and the provider to come to a consensus on what would best suit the situation of each of the patient. There are drug strips to be handed over to the treatment supporter. For every patient, a treatment supporter needs to be identified again based on the preference and choices and in consultation with the patient and the family members. The treatment support to the patients and regular monitoring is something which has to be done as a team effort between the staff of the health system at that peripheral level, along with the treatment supporter and the patient's family members, with complete care and compassion and addressing all the needs of the patients. There is monthly clinical follow-ups which has to be regularly followed, and all the way up to the treatment outcomes, the patient has to be supported by this team, so that necessary compassion is extended and support is extended to the patient. When it comes to treatment adherence, the age-old system of decade-long experience of using direct observation of treatment as a principle still holds true, and this can be extended by any healthcare facility staff, or through a community treatment support system, or very recently the Government of India has taken this conscious decision to respect the family members and train them and give them the necessary capacity building to be able to perform the direct observation of treatment for the patient. So all these methods are possible for that human interaction to support the patient to adhere to treatment. Apart from that, to support and supplement the treatment adherence monitoring, information communication technology based adherence models and systems have been tried, tested, and are being scaled up in the country. These include a system called 99 dots, MERM boxes, which is medication event reminder system, self-reporting in the form of call centers or IVRS systems on their mobile phones, SMS reminders to the patients, pill counting. These are all the methods which are now possible to be used in conjunction with the human interaction of dots to strengthen the adherence monitoring on a much more real-time basis. This is an example of an IT-enabled adherence monitoring. This is 99 dots, and you see that the daily FDC strips can now be sleeved using specially designed sleeves which has numbers hidden behind the flaps from where the pill can be removed. So this is the front side of how a sleeved FDC looks like, and you would see that there are also specific instruction both in Hindi as well as in English on when to take the medications, how many pills to be taken by the patient. It also reminds the patient on calling up a hidden number, give a missed call on the hidden number, so that there is no cost involved. However, before starting this patient on a 99 dot system, the patient's number either a mobile number or a landline number has to be registered onto the system, so that the system recognizes that this is a number of this particular patient who has called today, which means he has opened the script. On the reverse of this particular sleeve, you would see those serrated openings which can be opened by the patient depending on the number of pills. So it also gives a direction on when to start and how to move and where to end to complete this particular strip. So if a patient has to take 2 pills, they would open the 2 pills, and behind the flap of one of the pills they would find a toll-free number. This would be random toll-free numbers printed on the sleeves, and the patient has to just make a phone call to this particular number, which is free for the patient, but they have to use the same registered number which they had used at the time of registration on the 99 dot systems. So this is the 99 dot systems. So the moment a free call or a missed call goes on this particular number, the system marks that this patient has taken the pill in hand, which 99% of the time matches with the pill swallowed by the patient. So this is an adjunct as an ICT based adherence monitoring system to substantiate the treatment adherence systems. And on the system, the treatment supervisors, the district TB officers, the state TB officers, and the caretakers would all be able to see the progress of each of the patient. The red marks that you see are the days when a call did not come from that particular patient. A green mark indicates that the patient has made a call on that particular day. This helps the supervisors and the systems to identify patients who have a higher risk of discontinuing treatment, and home visits could be planned accordingly to find out the reason why the patient is irregular on treatment, or why is he not making phone calls, or whether he is really taking the tablets or not, and what are the reasons for missing the tablets, so that it could be appropriately managed. Another system is the MERM box. So this MERM device is designed to remind the patients to take the medicines on a daily basis. So there is a daily reminder which is set into the box, and visit the health dispensary for monthly refill of the box. So these reminders are automatically set in the box. It also assists the doctors and the field officers and treatment supporters as an adherence measurement and monitoring tool to support the effective patient counseling, at the same time assist the overall treatment management. Alert mechanisms are set in these boxes. There are 3 LED lights on one side of the box, and one audible buzzer is placed in that device. The daily medication reminder has a green LED and a buzzer which indicates that it's a daily reminder call. The medication refill reminder will be indicated by a yellow LED light, and low battery alert is indicated by the red light. Normally the battery of this particular device lasts for 6 months duration, which is approximately the duration for treatment for any drug sensitive TB patient. And the same device can be used tagged to the phone number of that individual patient at the time of refill on a monthly basis. Apart from this, the program also addresses comorbidities. The primary comorbidities addressed in India are the HIV TB co-infection, the TB diabetes comorbidity, the TB tobacco collaborative activities, and very recently the TB nutrition guidelines have also been issued, and systems are being developed to develop an app called NTB app. So in the TB-HIV collaborative services, the policy is that every TB patient has to be offered an HIV counseling and testing service, and all those who are identified as HIV TB needs to be offered a cotrimoxazole preventive therapy, and for HIV TB patients, ART, which is antiretroviral treatment, is also recommended. Apart from that, 4 symptom screening for all PL-HIV patients is also recommended. Isoniazid preventive therapy is also recommended for all PL-HIV. who do not have TB or in whom TB has been actively ruled out. There is a likelihood of changing a drug to rifabutin instead of rifampicin, particularly in patients where second line ART is recommended. And this collaborative mechanism exists all the way from the national level to the healthcare facility level, and cross referrals of patients for counseling, testing and management is a routine process. Likewise, there is a collaboration with the non-communicable disease control program for TB diabetes cross referrals, where every TB patient needs to be screened for diabetes, and likewise every diabetic needs to be screened for symptoms of TB, and intensified TB case finding is to be done amongst all diabetic patients at NCD clinics. Similarly, for TB tobacco collaborative services, there are quitting efforts for TB patients recommended. Counseling is recommended to quit tobacco amongst all these TB patients, and intensified TB case finding in tobacco cessation clinic has been initiated. Thank you so much.